Hello, so today we're going to see how I'm going to solve this anterior crowding. It's not a complex case, it's very moderate, but I'm going to show you the way I will develop the staging. So let's start the case. I will start with the upper arch because we have some contacts here. As you can see, we have only contacts in the anterior segment. So, and this contact here, in the previous case, they tried to fix this crossbite. Now the doctor is just requesting to work from 2 to 2, from 3 to 3, sorry, anterior segment. So we're going to start with the upper arch to relieve these contacts and these other contacts so we can create some sort of bite jump when we release them and close the posterior bite. You can see there's no contacts in the posterior segment. We're not going to fix this crossbite as it was only requested to make the anterior segment. So let's see how are we going to work it out. So we have this very simple case. So let's finish with the staging. So what are we going to do initially with this lateral incisors? As you can see, it has some rotation distal out. So we're going to step one, and in our staging, what are we going to do is to add the movement from the very beginning, but we have to check initially how much, if you have some sort of proclination, which is a movement that I would do along at the same time. So we have 6 degrees of proclination and 10 degrees of rotation. So initially, we're going to do that. So uh, let's do it. And we have some sort of 6 degrees. So let's work around 4 for 4 point something. And we also do the hinge movement, which I don't remember how much it was. So let's check how much movement it has. And let me remove, I only need the movement table. It has 10 degrees. So also we're going to do in the same step one, the hinge movement for almost the 10 degrees, but you can see we went locally. This is something that usually happens. You go a little bit distal as well, mesial, so you can create some space. So we did already 7 degrees, and then the mesial in, it's going to be the rest of the movement. So we're good over there. And let me just stretch this movement out in the staging panel. And 1 second. So now going to have this movement from the very beginning. You can see the distal out. We may have some collisions here, so we're going to make some round tripping with the canine. Move forward a little bit to let this lateral incisor move freely. As you can see now, we have done the staging for the lateral incisor, distal out with proclination, and then mesially in with still some proclination as well. So you can see the mesial out and then the distal out and then the mesial in. So we're going to do something similar in the canine. We're going to push him forward just a little bit, open the contact here for this lateral incisor, and we're going to do some sort of round tripping. Just let me work something in the staging now, and there we go. So now we're going to have the buccal movement of the canine that we didn't have from the beginning, and we are leaving space for the lateral, which is something very important. Actually, I'm going to move the canine a little bit further, the comeback movement of the round trip in a little bit forward so I can leave even more space. So we go forward and then the round trip starts. And actually, I have to this. Hold on. No, actually, it has also some rotation, you can see. So in that movement, buccally, I'm going to give, because now the canine goes buccally and then does mesial in with some retraction, which is good. Maybe we can just leave it like that. And let me also fix something here. So now we have the buccal movement of the canine, giving the space for the lateral incisor to derotate, and then the hinge movement with the mesial in for the lateral incisor. And then we go to the central incisors. So we need to do this teeth by teeth. That's why making treatment planning takes so much time if you're doing good treatment plans, because I have seen many treatment plans that everything goes at the same time. They don't make any hinge movement. They don't create space. They don't use round tripping. So it's very important to create space before moving the tooth or during the movement of the tooth, create space with the other tooth. So let's see now the contacts that we're having here, 0.06, then 0.11. So also here we need to do something about it. Let's check the movement of the central incisor. So central incisor doesn't have much rotation, but only proclination, that we can leave it as it is with no staging, no special staging. And this one, probably we may have to slow down or delay the movement so we don't have this collision and wait for the central incisor to move forward and allowing the space creation for this other tooth to move. So we may delay this, sorry, we may delay the other central incisor to be moved till we have some space here. So now I have delayed the movement and it's not going mesially buccally. You see it starts moving to aligner 3, and we can even make it a little bit longer, the pause, but we're going to have problems with the other lateral incisor. So we'll have to see what we can do with the other tooth, delay as well the movement of the lateral incisors. We're still working in the 15 aligners, so we're pretty good, I think. This should be an easy case, not a complex case. But let's start managing from the canine. You see we have the canine. I always work one side of the staging first and then the other one. So let's see, we start from this premolar. This will also require some space here to create that negative torque. You see that? And by creating, we don't need to move it buccal, or we just need to give a little bit of torque so we can intrude a little bit this cusp and create some sort of bite jump. So you see, that's what we're looking. I don't think we need any additional staging here or any special movement. And the canine, let's see how much movement it has. This canine has 9 degrees, sorry, 11 degrees of rotation and some pro inclination. So let's give this canine the proclination and we're going to give all of the proclination to the canine, the 3 degrees and something that we had. And we're going to give the rotation at the same time. 11 degrees. Let me just double check where is the rotation. So it's a mesial in movement. So let's do the distal out firstly. And let's do, so distal out will be here. So let's make around 8 degrees. Or we can make it mesial in as well, but let's make some distal out initially, and then also we push too much forward. Maybe it needs a little bit. So let's just create some space. Then we go in the staging panel just to fix what I just did, and avoiding the red contacts because remember, sorry, the red collision, we don't want the tooth to go far away from our limitations. Be sure you have home to do these movements usually. If you think you're reclining and moving forward too much, decrease the forward movement. But this is how you should be doing your staging. Distal out movement and then mesial in. This will be more predictable and easier for the aligner, you can see. So now let's work to this lateral incisor as well. I think this one is going to be, the movement needs to be after we start moving the central incisor. So let's move the central incisors first and create some space here. So this also help us here to derotate the lateral incisor since the beginning of the movement. Let's check how much movement the lateral incisor has. So it has, let's see, 5 degrees of rotation and some slight pro inclination, so nothing severe. So let's go again to step 1. I always do, if I need the movement from the beginning, I do it on step 1. If I do it around here in the final steps, I will do it in the final steps. So it's only 5 degrees, so let's do around 4. Go to the staging panel and let me just fix the limitations. So now we have, oh, I didn't do the proclination, which was only 3 degrees, I think, something like that. So let me go back and make as well the pro-inclination and the center of resistance back in the tooth. Whoever says that making treatment plan is easy, he has never done treatment planning. Treatment planning, it's not easy to do, to be honest. It takes a lot of time creating predictable treatment plans. And yeah, it's not easy and takes a lot of time usually, but we love it. So let's see now what we have. Let's delay the movement of the lateral incisor. We have some space here created. So now you see everything goes smoothly. Space everywhere, space everywhere. This is what you should do. Now this tooth, it's coming back. And we may start having some collisions, but what are we going to do? Let's just delay the retraction of the canine a couple of steps, and that's it. And let's make the movements of the lateral a bit faster so we don't have a huge treatment plan. So now let's check what we have here. And you see how nice everything flows. So this is the correct way to create treatment plans, always creating space, always making predictable movements such as hinge movements. Every tooth usually needs to be control the movement in order to be predictable and open space before moving them. Usually the posterior segment, it gets expanded. Probably here we'll have to release also this contact by some torque because I want to create a bite jump. So if I have contacts, the bite jump, it's not going to happen because we need to close the open bite. They create a treatment plan trying to solve this cross bite here, but they just created the open bite and the cross bite wasn't fixed. So now the doctor only wants the anterior treatment plan and closing the posterior segment. And this is done by disoccluding and created a jump. The mandible should close after we have released or fixed the premature contacts. So that will be everything for today. I hope you have enjoyed it, and I'm so sorry that I took too long in posting another case. And if you like this video, please subscribe to my YouTube channel. And I also offer, as you know, training sessions. They are one-on-one sessions, so you can take advantage of all of my tricks and tips and my experience doing treatment plans. So I hope you enjoy it, and thank you so much, and have a wonderful day.